Hi, my name is Sarah Bowen. I'm a registered veterinary technician and I work at the Ontario Equine Hospital in Mississauga. Over the course of a normal work day, we are a surgical referral hospital and we also do nuclear scintigraphy. So basically this means that other veterinarians will refer patients to us for surgical procedures or for bone scans. As an RVT at our practice, we are responsible for doing physical examinations on the horses when they first come in. We do a typical physical exam, make sure they have no wounds or anything else that we need to note down. We also do blood draws and do routine pre-surgery blood work in our in-house lab. We're also responsible for inserting the IV catheters before surgery and administering any veterinary prescribed medications to them before surgery. Once the horse is in the surgical suite, I'm responsible for all of the surgical prep, the clipping of the surgical area and scrubbing and anything to do with the prep of the surgical site. Occasionally, we get to assist with certain surgeries if the veterinarian needs an extra pair of hands. The RVTs are responsible for injecting the radioactive isotope. We have very, very strict protocols that we have to follow for the nuclear medicine. So after we've injected the radioactive isotope, we'll take the horses into our nuclear scintigraphy room, and we use a gamma camera to take the images for the bone scan. So a typical bone scan is about 50 to 60 images, which can take up to 3 to 4 hours to do. When we're finished with that, we're responsible for putting together all of the images and giving them to our veterinarian so he can make the assessments. We are also responsible for post-surgery things such as removing the catheters, giving any post-surgical medications prescribed by the veterinarians, making sure that the patients have the bandaging material that they might need to go home with, depending on what their surgeries were. And then we're responsible for cleanup, such as, cleaning the instruments used, repacking them, sterilizing everything, and general cleanup of the facility. And that is pretty much what we do over the course of a day. Some of the traits I think you need to have as an RVT, especially in a busy surgical practice such as ours, is I think you need to have the ability to think and plan ahead. There are some days when we have 3 or 4 surgeries and a bone scan over the course of the day. And on those days, even when I'm driving into work, I'll find myself going through what I think my plan for the day will be, what I'm going to do when I get to work, what order I want to do things in. It doesn't always go according to plan, but I find it makes my day go easier if I have that ability to think about what I want to do before I get to work. Another important trait I think to have is you definitely need to have attention to detail from everything we do, from putting in the IV catheters to verifying the medications given to even when we're cleaning and doing sterilization techniques and with the packs. It's so important that you're paying attention because some mistakes are unforgivable and you don't want to go down that road where you've done something that you can't fix at that point. So I double and triple check almost everything I do. Even now, after working for years as a tech, I find myself checking everything that I do. You need to be calm under pressure and not panic when things might go wrong. And again, going along with the busy practice, the ability to multitask is also important. Like you need to be able to do multiple things at once and do them properly at the same time. Some of the challenges I think in a busy practice such as ours is, again, handling the multiple situations that are going on at the same time. There will be surgeries, there could be bone scans. We have consultants that come in, such as equine dentists and ophthalmologists, and the RVTs are there to help basically everybody. So on some days, trying to handle everything that's going on can be a challenge. It's interesting, it's always interesting, but again, I think it is challenging when you feel like you're being pulled in different directions, but you're trying to help everybody at the same time. Another challenge, especially at our practice, is dealing with fractious patients. We get such a wide range of patients that come in, from feral yearlings that have never been handled to geriatric patients. We've had miniature horses to Clydes. We've had the occasional donkey, the occasional alpaca, and you never really know how they're going to react. I mean, horses can be unpredictable at the best of times, and they're in a stressful environment. So sometimes dealing with them in that situation can be very, very challenging. Another challenge I find, I think anyone who works in the veterinary industry would find this, is that sometimes the outcome isn't what you hope it's going to be. And sometimes the horses can't be saved that come into our clinic. And controlling your emotions on days like that can be very, very difficult. Obviously, we're all in this business because we like working with horses or we like helping animals. And sometimes whatever they're in there for, they can't be saved, and it can be really tough to deal with emotionally. Um, so that is sometimes a hard thing to deal with as well as a challenge. Some of the advice I would give is get as much experience with horses as you can. Um, Such an important part of our job is being able to look at the horse and try to interpret whether it's painful, whether it's comfortable, whether it's eating, whether it's colicking. There's so many things that go on. The more experience you have handling them, it gives you such a good basis. Listen to everyone that you work with. I've had the opportunity to work with some incredible people, from the barn help right up to the surgeons that I work with. And I think you can learn something from everyone that you work with. So it's very important to be open to learning and listening to people who are trying to teach you things. Like, I've learned how to handle horses differently from the people who work in the barn. And I've learned some incredible things from the surgeons that I get to work with. I learn something on a daily basis. I've been in the industry for 22 years now, and I feel like I still learn things today that I, didn't know before. And so I think being open to learning is so important when you're working in this profession. I became an RVT, not intentionally at first. When I grew up on a thoroughbred racehorse farm, I showed hunters and jumpers when I was younger, and I had the intention of working with horses when I was growing up. I went to university for something completely different. When I graduated with my degree, I kind of looked around and couldn't decide what I wanted to do. So I traveled for a bit, and I went to England, and I was with my uncle, who was an equine vet. And while I was over there, I thought maybe I do want to work with horses. So that's when I applied to the vet tech programs in Ontario and decided that that was the path I was going to go. And I haven't regretted it. I think the most satisfying part of being an RVT is being part of a team where the main goal is making the life of the horse better. I think that's the most rewarding thing that I've been around. Is every horse that comes into our hospital, the main goal is to try to fix whatever is wrong or going on and make that horse's life better. Our surgeon, who we work with, is so fantastic at following up on the recovery of these horses that we feel like we're part of it, seeing it from the beginning through the surgeries to the end, where the horses are feeling so much better. And it's so great to see. It's like you're part of the whole recovery process. Another thing I find very satisfying is when I'm doing a bone scan and you can find what is bothering the horse. And I hope that gives you an idea of what an RVT does. I wish you all the best in your equine pursuits.